This video is perhaps the most important video for you to watch, no matter what procedure you have afterwards. The reason for this is that about the only thing that upsets my patients afterwards is someone saying something to him or her that was not necessarily intended as being unkind, but it was read as such. And the reason for it is perhaps just a callous comment from a loved one, such as, "Mom, why did you have this done? I liked you before. You look so much better. You look so weird this week, honey. Why did you choose to do this?" Even though your loved one may be supportive of you, they may have said something quickly, undeliberately, where it was not intended as a negative comment, but can be easily read as such, and then you internalize that. That week, when you're swollen and a bit distorted and not quite there yet, I encourage, especially your loved ones, to be as supportive as possible. But remember one thing: whether they're jealous of you, whether they love you, whether they don't even care and they just made a comment, don't internalize that comment. It's so easy for me to say that, I know this, but it's so important for you as a patient to truly understand that no matter what comment whoever makes at the office, wherever it is, if someone notices it, just be proud of your decision, be confident with your decision, and be comfortable with it. Because it's not an easy decision to consider elective cosmetic enhancement of the face. But remember, someone out there may say something to you. And if you ask me, well, when would someone not notice it? As you saw in my recovery videos, my video diaries, and other types of videos that I have out there, the recovery is not tremendously long for a lot of the procedures that I do. But I always say that the only thing I can predict about human nature is that it's unpredictable. In other words, I don't know if someone would say to you something in 2 months. I mean, that is pretty unlikely. But the idea behind this is that don't let it internalize, don't let it affect you, don't internalize that comment. And I just repeat that. Oftentimes, if your child, your spouse, whoever it is, says something to you that may not be the most supportive, it's just because they don't see it, and they may just be reacting out of you're reacting to your fear. And a lot of times what I tell my patients, they say, you know, someone acted weird to me in the office place. What was going on with that? And I'll tell you, oftentimes the reason for that is that you were acting weird to begin with, because you went over there scared, is someone going to notice? What's going on? And then when they come and talk to you, then you're wondering, did they notice something? And then they're saying, what is that person acting? Why is she acting weird? And maybe she had something done, or she's doing something. So here's the thing: the way that people respond to you is the way that you present yourself to them. And if you're in this fearful mode where you're just worried, is someone going to find me out, is something happen, it's going to make it even harder for you. I'll be honest with you. So I just want you to keep that in mind, is that don't internalize what other people tell you. It's about the only thing that upsets my patients after a procedure. Not the only thing, but one of the major things that upsets my patients is some comment made by a loved one, or someone that doesn't love you, or someone that doesn't even know you, about something about the procedure, and it just gets you going. Oh, why is this part uneven? Did you see this little thing? Why is that? All of this is that it's just very, very common. And I just want you to feel comfortable with your choice with me, your choice with the procedure, that someone's going to say something, and then you're going to internalize it. Try not to do that as much as possible. Hopefully this video you find helpful for your postoperative time.